Hello friends, today we are going to conduct a lecture on anticoagulant drug. This drug act on clotting mechanism or a clotting process, and they are prevent or inhibit the formation of clot in the blood vessels. This drug or the history of anticoagulant is one physiologist is there known as John Muller. He describes the term fibrin. Fibrin is a substance which forms the thrombus, and this discovery is a first milestone for the anticoagulants. Later in 19 later in 1890, Arthur discovers that calcium is required for the coagulation process, and after that theory, thrombin is generated by in the presence of tissue factor was consolidated by Paul Moravitz in 1905. Then later in 1916, Rouse and Turner, these two scientists used first anticoagulant as a preservative. This coagulant contains citrate glucose solution, which is used to store human blood during the First World War, which is in 1987. And heparin is one of the oldest drugs which is currently used in the clinical procedures. Originally, it was isolated for canine liver cells, and therefore its name is heparin. So, definition of anticoagulants is a substance prevent coagulation or clotting of blood, but it doesn't act on the clot which is already formed in the blood vessels. The purpose of using this anticoagulant is to study various constituents of blood components. Then study of coagulation or study of clotting mechanism, how they act on this clotting mechanism, and third one is preservation of a blood in the blood bank. Properties of ideal anticoagulant are, that means how the anticoagulant drug are ideally be, it must be soluble in blood, it must be kept in the blood in a fluid condition, it must not be bring hemolysis of blood cell, it must not be change the size of RBCs, it must minimize the destruction of leukocyte, it must minimize the aggregation of platelet, because due to aggregation of platelet there is a initiation of clotting mechanism, or aggregation of platelet forms a plum or plug which create the disturbances in the blood flow. Now the general introduction of coagulation we will see shortly. Coagulation is a total cascade of enzymatic reaction, and at the end of that soluble fibrinogen is converted into the fibrin strand. Fibrinogen is a protein which is soluble in plasma, and it is presented in the blood, which is produced by liver. All time liver producing fibrinogen and releasing it into the blood. Every drop of blood have some amount of fibrinogen. Then in normal blood flow there is a presence of fibrinogen, and platelet helps in the coagulation process. But coagulation is a process, it is done by plasma alone, in which soluble fibrinogen is converted into the insoluble fibrin strands. Healthy endothelial cell surface present a chemical which is known as heparan sulfate. On this molecule, a special type of platform are called antithrombin 3, and this antithrombin 3 is produced by liver, which is present in the blood. This antithrombin 3 have a main function is to cut down the thrombin molecule, and therefore due to breakdown of thrombin molecule coagulation inhibited. Thrombin is main factor in the coagulation, and this antithrombin 3 does not tolerate the thrombin molecule on endothelial cell surface. This process generally occurs in the normal blood flow or normal anticoagulation process. After injury or when injury occurs in the blood vessel, then there is a vascular spasm. Vascular spasm in which vasoconstriction is done just after the injury happen or before the hemostatic mechanism will start. After that there is a platelet plug formation. That means after vasoconstriction, vessels start to dilate, in which platelets adhere to each other and platelets start to aggregate in the blood vessel or at the site of injury, and due to platelet aggregation, blood clotting process is started. Then activation of various chemical mediators, which convert the liquid form of blood into the jelly like substances or in the gel, and clot will be formed. These are the various clotting factors which are involved in the coagulation cascade and which helps or which form the clot or plug in the blood vessel, and then coagulation of blood are occur. These are 13 coagulation factors present in the blood cells. Then formation of clot, how it works or how clot is formed. Then intrinsic and extrinsic pathway, these are the pathway, these two pathway, how they act. Intrinsic pathway is a procedure or it begins with any factor which causes damage or trauma to the blood cell directly or causes blood cell exposure to the collagen. Then after this injury happen or after this trauma, factor 12 activated, and this activated factor 12 converts the factor 11 into factor activated 11, and in presence of calcium ion, factor 9 is activated. Along with factor 9, activated factor 9, there may be conversion of, in the presence of calcium ion, the factor activated 10, and this activated factor 10 in presence of calcium ion, prothrombin activator will be activated. This prothrombin activator again act on prothrombin, and then there is a prothrombin convert into the thrombin. This thrombin is convert fibrinogen into the fibrin monomers. Fibrin monomers are the single thread which present in the blood at the site of injury, and in presence of calcium ion, this fibrin monomers is again converted into the fibrin polymer, and this polymer is nothing but the clot or bunch of various threads, that means clot or plug of the fibrin. This is a procedure of extrinsic pathway, how it works. Then now extrinsic pathway, which is activated by any tissue trauma. Then this tissue factor act on factor 7 and it activate the factor 7. In presence of calcium ion, tissue factor and activated factor 7, those act on factor 10 and it converts into activated factor 10. This activated factor 10 is again act on prothrombin, and prothrombin activator in presence of calcium ion again form the thrombin. Then thrombin convert into the fibrinogen into the fibrin polymer monomers, and then in presence of calcium ion again there is a formation of clot or fibrin polymers. Now this intrinsic and extrinsic pathway, these two pathway initiate the coagulation process, or these two pathway helps in the coagulation process activation. Then after this formation of coagulation or coagulation cascade, one point is there, which is fibrinolytic system. This system provides check and balance so that clotting process does not go out of hand. It dissolves the clot at the site of damage once damage is repaired, and this process of dissolution of clot is known as fibrinolysis. This generally occurs in the healthy person, but if this system fails to repair or fails to dissolve the clot after repairing of the blood cell, then there is a coagulation of continuously coagulate the uh, platelets, or there is a continue formation of clot. After this clot formation, then blood flow disturbances is there. After disturbances in the blood flow, it may cause hypoxic condition, where the area which is affected by the clot, and which hypoxic condition is leads to the cell necrosis or cell death of that affected area. Now this natural anticoagulant mechanisms are also present in the body. How they act, we see. One is a substance, is a prostacyclin. It is a metabolite of arachidonic acid and produced by endothelial cell. Now this prostacyclin is present in the normal healthy endothelial cell surface, there where it acts on the thromboxane A2. This thromboxane A2 helps in the coagulation system, or which initiate the coagulation. Again, after inhibition of this thromboxane A2, we inhibit the platelet aggregation, and inhibition of platelet aggregation definitely which denies the formation of clot. Another is thromboxane A2. Thromboxane A2 is the substance which is again present in the healthy endothelial cell, and this thromboxane A2 is produced by liver, which is present in the blood. This thromboxane A2 have main function to cut down the thrombin molecule, and due to the breakdown of thrombin molecule, there is a anticoagulation effect in the blood vessels. Third one is the protein C. Protein C is generally present in activated form in the body. The molecule which is known as thrombomodulin, which is present in the endothelial cell surface in the blood vessel. Thrombin is present in the blood, and thrombin is normally helps in the coagulation process. But if thrombin is caught by this thrombomodulin, the thrombin will activate the protein C, and protein C which engulfs the activated factor 5 and activated factor 8. Due to phagocytosis, or due to the engulf of these two factors, there is a inhibition of coagulation mechanism. Again, last one is heparin sulfate. Heparin sulfate is a proteoglycan which is related to heparin, and it is synthesized by endothelial cell. This heparin sulfate is also present in the normal endothelial cell surface, and this molecule is a platform on which antithrombin is present, and we already see the mechanism of antithrombin, how it acts as a anticoagulant. These four mechanisms are involved in the natural anticoagulation system. Generally, they help to maintain the blood in the liquid form and supply to the normal blood flow. Now, after this coagulation process, we see the anticoagulants. Now, the classification of anticoagulants are, these are basically divided into on the basis of route of administration, that is parenteral and oral. In the parenteral drug, there is a three class: thrombin, thromboxane, direct thrombin inhibitors, in which we see the unfractionated heparin, low molecular weight heparin, fondaparinux, and direct thrombin inhibitors. These four categories are involved in the direct thrombin inhibitors, and the drugs which are under these categories, they are administered parenteral route. Then another is oral anticoagulant. These oral anticoagulants are again classified into the three various classes, in which first is vitamin K inhibitor. There is a two type of vitamin K. Vitamin K is actually act as a coagulant, and vitamin K inhibitors act as a anticoagulant. Two types of coagulant, that is vitamin K, which is clinically used to coagulate the blood. One is local and systemic. And vitamin K is divided into the three form, that is vitamin K1, vitamin K2, and vitamin K3. This type of vitamin K are present in the body, and this name of vitamin K is according to their sources. The drugs like warfarin, dicumarol are involved in this process or in this class, and which prevent the excessive clotting. After inhibition of vitamin K, there is the decrease the clot formation. Second class is factor 10 inhibitor. Activated factor 10 along with factor 7 and factor 9. These three factors are very important in the coagulation, because these factors stop the bleeding and initiate the process of coagulation. If we remove these factors, then automatically the coagulation process will disturb, and there is inhibition of clot or inhibition of formation of coagulation. Then example of this class, that is factor 10 inhibitors, are riboxazine and apixaban. These two are the common example. And third class in this oral anticoagulant are direct thrombin inhibitor. These are the agent which directly on the thrombin molecule, and then thrombin is the molecule in the coagulation process which helps into the conversion of fibrinogen into the fibrin. And after this inhibition, automatically there is the prevention of coagulation. The example of this direct thrombin inhibitor is dabigatran. Now we see the oral anticoagulants, how they act and what are the examples of these oral drugs. Oral anticoagulants involve one very common example is warfarin. It is the first anticoagulant which is used in 1951. It discovered as initially anti-rodenticide, but later in 1951 it is used as, or it is identified as, a latent, potent and useful anticoagulant. This shows result in the in vivo studies only, because this warfarin act on vitamin K induced clotting factors and stop the clotting or prevention of coagulation. Therefore, it shows results only in the in vivo studies, not the in vitro study. This warfarin is act by interfering the synthesis of vitamin K, and vitamin K is the very important into the coagulation process. If we want to dissolve the clot, then or hinder the coagulation and or reduce the ability of coagulation of vitamin K, then we inhibit, and the factors which are vitamin K dependent, which is present in the liver, are the factor 7, factor 9 and factor 10. When we inhibit these factors, we stop the initiation of process of coagulation, and these drugs block the gamma carboxylation of glutamate. This gamma carboxylation of glutamate is very necessary for the clotting mechanism because it initiates the process of coagulation, and after blockage of this gamma carboxylation of glutamate, there is a reduce the prothrombin, and along with the decrease the synthesis of factor 7, factor 9 and factor 10. Again, inhibition of these factors along with prothrombin, which automatically decrease the clotting process. These above all steps are interlinked with each other and they prevent the coagulation. The main mechanism of action of warfarin is warfarin blocks the gamma carboxylation of glutamate residue. It inhibits the factor 7, 9 and factor 10 activity. Also, it affects the protein C and S. Above all, the processes are important in the coagulation, and due to inhibition of these three processes, there is incomplete coagulation factor molecule form, and formation of this incomplete molecule, there is a disturbances of normal coagulation process, and there is a deficiency of clotting factors. That is, due to deficiency of clotting factor, the clotting mechanism will disturb or clotting will not be formed. After the mechanism, we will see the pharmacokinetic of this warfarin. Pharmacokinetic means what does the body do with drugs. Then absorption of warfarin is 99% done, that is high bioavailability of this drug. Bioavailability means nothing but the actual concentration of drug in the blood. Obviously, if there is a 99% drug absorbed in the body, it will available for the effect. Warfarin available in the two form, that is levorotatory and dextrorotatory, in which levorotatory form is potent for the action. Elimination of this warfarin through urine, and it metabolized by microenzymes which is secreted by liver. The common ADR or ADR which occur due to the overdose are very easy to remember. That means which are the hemorrhage. Hemorrhage which occurs due to the if drug are not able to stop bleeding, then continuously bleeding are there, and then hemorrhage will occur. Bleeding in the brain and intestine also can occur. Now next class is factor 10 inhibitor. Factor 10 inhibitor or factor 10 is an enzyme named as serine endopeptidase. It is important to conversion of the one process into the another in the coagulation cascade. This factor 10 is activated by coagulation factor thrombokinase. This is also enzyme. So activated factor 10 is enzyme which is derived, and this smoothly proceed the coagulation steps in one by one. There are two common examples is rivaroxaban, which is used in the DVT and which also used to prevent the venous thrombosis. DVT is the thrombus present in the deeper vein or clot present in the deeper vein. Another example is apixaban, which is used for prevention of stroke in the atrial fibrillation. So these drugs are also called as blood thinner. Then drug interactions. Which are the drug interactions with oral anticoagulants? Drug interaction generally happens when two or more drugs are given at a time. Then some drugs are react with each other, and then it either decrease the activity of other drug or either it may increase the activity of other drugs. So basically drugs or those drugs which inhibit the platelet coagulation, when it gives with the oral anticoagulant, it potentiates the action of each other, and anticoagulant activity and platelet coagulation. Both processes are more effective and decrease the result of or increase the result of anticoagulant. The one common example is there. If NSAID gives with warfarin, it increase the internal bleeding. Another mechanism of interaction is drug. Those are used or drug which inhibit the hepatic metabolism. If they prescribe with oral anticoagulant, they can cause, that means if inhibition of hepatic enzyme secretion which useful for the drug metabolism. That's why there is a prolongation or prolong the action of anticoagulants. How? If hepatic enzyme inhibit or there is a prevention of secretion of hepatic enzyme, it means decrease the degradation which occurs by which is caused by hepatic enzyme, and due to inhibition or decrease the degradation of drug, there is a chances of accumulation of drug in the body, and due to accumulation toxicity can cause. So saturation of drug in the body due to degradation will not do properly. Third mechanism is the drug, those which increase the metabolism of anticoagulant. If these drugs are prescribed with oral anticoagulant, what they do? They decrease the effect of anticoagulant. How? Because if they increase the metabolism, then drug eliminated fastly from the body, and due to fast elimination, effect will be decreased and availability also decrease. Then after the drug interaction, we will see the uses of anticoagulants. So oral anticoagulant will prescribe for venous thrombosis like DVT. Another use is it is used in the post-operative patient for to prevention of the clot in the post-stroke patients. And third use is it is used in the unstable angina. That means unstable angina is the pain which occur during the resting position, and it generally related to the CAD. So these drugs, these oral anticoagulants are used in this above condition. Now we will see the systemic drugs or drugs which are given parenterally for anticoagulation purpose. So common example is heparin. Heparin is the drug which discovered in 1916. This drug extracted from liver cell, and so it named as heparin. This is a strong anticoagulant and which shows the result by in vivo and in vitro studies also. So this drug is known as life-saving drug. How this heparin is act, or what is the mechanism of action of this heparin? So naturally or physiological process of coagulation and anticoagulation is if injury occur, the blood leak out from the vessels and hemostatic condition start. After hemostatic mechanisms start, there is a coagulation occur or platelet aggregate at the site of injury, and then coagulation occur. There is a formation of plaque or clot, and then after recovery of this injury or repairing of this injury, the bleeding will stop or clot may dissolve in the body. This normally happens in the normal circulation. Now this heparin is a drug which is act on the activated antithrombin 3. This antithrombin 3 is the molecule which is synthesized in liver and circulate in the plasma. This agent which against the thrombin act as against the thrombin. It inhibit the activated thrombin along with activated factor 10 and activated factor 9. So if there is a inhibition of this antithrombin 3, there is a inhibition of activation of thrombin and factor 9 and 10. Therefore automatically there is a inhibition of coagulation process. This is a physiological reaction, and heparin activate it by 1000 times, so clotting time prolonged. Heparin plus antithrombin 3, it gives the effect, that is decrease the activated factor 10 and thrombin. This is the normal mechanism of heparin, how it act on the antithrombin 3 and how it decrease the factor 10 activity. Then other pharmacological properties of the heparin is high dose of heparin can cause or it can interfere with the platelet aggregation and therefore it prolong the bleeding time. Lipoprotein lipase hydrolyze the triglycerides to triglycerol and free fatty acids. Heparin clears the lipemic plasma in vivo by causing the release of lipoprotein lipase into the circulation. So in the mechanism we already seen heparin which inhibit the activated factor 10 and thrombin, but the low molecular weight heparin which inhibit only the activated fiber 10, not the thrombin. This is very important. Heparin is not active orally, that's why it always given parenterally. In the parenteral administration, it only administered by subcutaneous or intravenous route. It should not be given intramuscular route because there may be a chances of hematoma, irritation or itching to the particular individual. Now the common adverse reactions with the heparin are bleeding, in which if the drug is not able to stop the bleeding, then there is a continuous bleeding due to the heparin, or activity of heparin is anticoagulant. That's why. Another ADR is hypersensitivity. Basically heparin obtained from bovine lung or porcine intestine by isolation. This is an animal sourced or animal source molecule which contains or which is the different immunologic conditions or different immunity from the human. That's why there may be chances of hypersensitivity and allergy may cause. Third is alopecia. Alopecia is the reversible condition in case of related to the heparin. It depends on the use of heparin. 0.5% people shows the hair loss when they administer or they take the heparin up to the 10 days. Then and then only the alopecia can cause. Another is osteoporosis. After long-term use of heparin, osteoporosis can cause. So duration is important related to this osteoporosis. And last one is hypoaldosteronism. Hypoaldosteronism is the decreased aldosterone due to the heparin, which affect the metabolism in normal healthy person. After this common ADR, we will see the contraindications of the heparin. Contraindications, that is the controversial conditions due to the heparin. If both drugs do not match each other's compatibility, then contraindications or controversial condition occurs in the body. First is a bleeding disorder. Heparin cause anticoagulant effect, and in case of bleeding disorder it may be fatal. Second one is hemophilia. In condition of hemophilia, blood do not clot properly in suitable condition, and if in patient of hemophilia prescribe the Heparin also decrease the clotting, and synergistic effect will show in this condition. In case of renal failure, it affect on elimination, and there is a chances of accumulation of drug or chances of toxicity. Again, it do not prescribe in severe hypertension and ulcer which in the gut. Internal bleeding may be caused due to the ulceration, and if heparin may give the use of the heparin, bleeding cannot be stopped. And neurosurgery, there is a increase the chances of internal bleeding in case of surgeries which is related to the brain. Then after the contraindication, there is the heparin antagonist. That means the drug which works against the action of heparin or nullify the effect of heparin. In case of mild overdose of heparin, we can stop the heparin and decrease the ADR. Heparin is a strong acidic in nature or strong acidic substance. That's why if we want to decrease the result of heparin or decrease the effect of heparin or nullify the effect of heparin, we can prescribe the basic drug which is basic in nature, which is the protamine sulfate is the drug which gives IV in case of severe overdose related to the heparin. The source is this is derived from species of fish, and dose of this protamine sulfate in the toxicity of heparin is 1 mg for 100 unit of heparin, and protamine sulfate binds with the heparin and which form the inactive complex, and that is nullify the action of heparin. This is the anticoagulant drug which act on the process of coagulation or factors which are involved in the coagulation process and how it decrease the coagulation cascade or formation of clot, and there is a prevention of coagulation process. So we finish this.